This is the subluxation cycle that affects you and your loved ones from womb to tomb. It starts up in the top left corner with life, and there's three kinds of stresses that we're all exposed to. There's emotional stress, chemical stress, and physical stress. Emotional stress would be anything like an argument, relationships, worry, fear, anxiety, you name it. This one is the most detrimental, believe it or not, for most of us. Chemical stress could be drugs, medications, sugar, pesticides, air quality, water quality, medication residue that's in our water, the public water supply. It goes on and on and on. Physical stress, that's going to be the main gravity. Gravity slips, trips, falls, injuries. Womb positioning is a big one that we see. There's plenty of examples that you can think of, but the big picture here is to realize that we are exposed to stress all the time. Now, throughout our life, our brain gets overwhelmed by this stress, and it could be one, it could be a combination of them, but it overwhelms our brain and our nerve system, which results in a condition called nerve interference or subluxation. Now, remember, your brain coordinates and controls every part of your body, so it is responsible for all of your healing processes and all of your function. So when there's nerve interference, your brain can't adequately communicate with any part of your body. That leaves you in a diseased or imbalanced function state. The 3% rule that I'm referencing there refers to 3% of your nerve pathways that are dedicated to carrying pain signals. So 97% of your nerve pathways don't carry pain signals. That's why in the office, we're going to focus on pain about 3% and function, other functions, the 97%. Now, it's important to pay attention to your symptoms and your pain because that's a warning sign. So we'll celebrate it when you have it because thank God you knew something was wrong. A lot of people don't until it's too late. But we're also going to celebrate it when those symptoms and that pain leaves because that's not the way God intended you to be living your life. Now, underneath there, we've got the imbalanced system and the resulting condition. Just listed a couple of these just to jog your mind, jog your memory, or just to give you some context to how vast this effect is of the brain. So with the immune system, if that's imbalanced, that's going to lead to chronic infections. Brain chemistry, when that's imbalanced, that can be anxiety, depression, OCD, the ADD, ADHD, or even addictions. Cardiovascular system, strokes, heart attacks, high blood pressure, cholesterol issues, unique blood cell or blood clotting mechanisms. Digestive system, irritable bowel syndrome, colic in infants. They can be all the way down to food sensitivities, allergies. There's a huge gut-brain connection that the whole healthcare profession is catching on to. But we've known that for a while. The brain runs everything. And then respiratory system, asthma, COPD, different kinds of lung disorders. But the big picture is, remember, brain runs the body. If the brain has interference and it cannot effectively communicate with the body or get feedback from the body, it's a two-way street here. The brain can't send a signal to the heart or get adequate information from the heart. We're left in this diseased or imbalanced function state. Now, when that happens, we go on to the next section here, where we are living with decreased stress response, health, and quality of life. And that's where our mission statement comes in. We're trying to reach as much of our community as possible so we can help improve their stress response, health, and quality of life. And we do that through gentle and research-proven neurologically based chiropractic. Now, for those who don't know what else to do, a lot of times the decreased stress response, health, and quality of life results in getting some sort of a disease or medical diagnosis. Now, when that happens, oftentimes there is a chemical stress added in the way of a medication or a drug, possibly an emotional stress with a label of being given a diagnosis. Sometimes that helps, sometimes it doesn't. But either way, that is fed back into the cycle. Now, until something is done to break out of this cycle, that individual will continue to accumulate more and more nerve interference until the decreased stress response, health, and quality of life gets to be greater and greater, and eventually it can become a chronic or terminal disease. It's not what we want, it's not what God wants for you. On that note, there is one component to this that led to this stress in the first place. And if you're wondering what that is, please ask me or ask one of the staff. Probably the most important question you'll ever ask, and we'd love to answer that for you. But what we can do here in the office for you is we can help point out those stresses in your life, help you be aware of it, help teach you how to limit, but we can't eliminate those stresses. It's a part of life. And some of them are good, right? Some of those make us stronger. So we want to be aware of that. It's not all bad stress, but typically the stress we're talking about here that overwhelms you, that is the distress we're talking about. What we'll do here, though, is we have tested, and if we found nerve interference with our state-of-the-art scanning technology, we'll be able to set up a course of action and a care plan to remove that. Now, we're not going to remove it or try to remove it with more stress, more chemical stress. We have state-of-the-art neurologically based chiropractic as a non-invasive way to reset those nerve signals. By resetting the nerve signal, it's a lot like restarting any kind of electronic device, the app on your phone or the whole phone altogether. When you restart it, your phone, which doesn't have this life intelligence in it, it's just a mechanical device, it sorts things out almost all the time. So you can imagine how well things go when we can effectively reset one of these nerve pathways and give your intelligent brain a chance to recalibrate, rebalance, and these conditions that were maybe once thought to be chronic or lifelong conditions, spontaneously, or if you want to call it that, we understand what's going on, but they resolve the way that they should have resolved in the first place if there wasn't nerve interference that was unresolved. So that's what we're going to be looking at here, to go through and find out where we can intervene by limiting life stress, being aware of it, but we cannot eliminate it. And then through the neurologically based chiropractic reset. Call it a reset because we're resetting a neurological pathway, the neurological frequency. We're not typically manipulating or adjusting the bone to take pressure off the nerve. But when we get that reset, the brain then can communicate with the body in a more effective way. Bottom line is, instead of decreased these three things, we have increased stress response, increased health, and increased quality of life, which is exactly what God intended for you and what we hope to be able to partner with you and help you with for the rest of your life.